Hi there. This video is for OHTs who are interested in the Ontario Health Team Patient Experience Survey. What is the Patient Experience Survey? It's a survey designed to measure things that individuals felt were relevant to having a good experience in the health system, such as accessing care, care transitions, having someone to count on, being heard, knowing how to manage their own health, health status, feeling safe, and digital or virtual care. To learn more about the development of this patient experience survey, you can watch our past webinars on OHT evaluation measures and surveys, linked in the description below. Why do this, you may be asking? Well, do you know the current state of patient experience in your OHT? Would you like to know? Ontario is advancing the quadruple aim as a framework for health system improvement and accountability, which includes patient experience as an essential component. Improving patient experience is a primary reason for implementing Ontario health teams. If you are an OHT that is interested in administering this survey to your patients, here's what you do. Check to make sure that you have the following. Determine the specific types of patients, for example, mental health, frail seniors or older adults, palliative patients, COPD, pediatric, etc., whose experience your OHT is interested in measuring. Identify the most appropriate organization within your OHT to be responsible for coordinating the survey administration. This organization needs to have the authority and capacity to collect patient contact information. The organization will then create the best possible list of names and email contacts to distribute the survey. The organization administering the survey can use the email and Excel templates available at hspn.ca and linked in the description below to invite patients and keep track of distribution and reminder dates. When your OHT is ready to distribute the surveys, your OHT's evaluation contact person can notify HSPN via email at oht.evaluation@utoronto.ca to let us know that you are ready to send out the surveys. However, please do not send us any patient contact information. We just want to know that you have the information and are ready to distribute the survey. Your evaluation contact person will receive an email from us containing a survey package, which includes a general user link to the patient experience survey to send to patients, a Word file with a survey invitation email template to send to patients, a PDF of the information letter for informed consent, and a PDF document of the steps and procedures to follow for your OHT survey coordinator, just in case they need a reminder after this video. All documents in this package, just like the patient experience survey, will be sent to you in both English and French. If your OHT opts to use paper surveys, or a patient simply wants one, you can print off a copy by downloading a PDF of the survey from our website, linked in the description below. However, please note that OHTs are responsible for entering the paper survey responses into the web platform using the provided link. Whenever you email new survey invitations, keep a log of the date you emailed your patients. 4 weeks after your initial batch of survey invitations, let us know how many new patients were emailed since then by emailing us again at oht.evaluation@utoronto.ca. And we will reply with a count of the number of surveys completed via the web-based platform by your patients. To avoid low response rates, we suggest emailing reminders every 2 weeks following the initial invitation to ensure better response rates, because reminders work. The web-based patient experience survey will be accessible to your patients for 6 weeks, after which data collection will stop. 2 weeks later, OHTs will receive their final data. And that's it. Now for a quick recap. When you have determined which patients you want to survey and the organization administering the survey, email us and we will send you everything you need. Once you have distributed the patient experience survey link and accompanying materials, Let us know how many patients were invited to complete the survey and the date of the initial distribution. Try to email your patients every 2 weeks for best response rate. 4 weeks into the data collection period, email us with the number of new patients invited since the first batch of initial invites, and we will give you a tally of surveys completed. The data collection period lasts 6 weeks. 2 weeks after closing, we will send your OHT the final set of results if there are 10 or more patients. Now, you may still have some questions, so let's try to answer some of them in this video. Who can be surveyed? The patient experience survey is intended for all types of patients. Who will be inviting patients to complete the survey? The OHT determines which patients they want to survey and the organization that will administer the survey. You can choose a few specific types of patients based on condition, or survey all patients in a particular practice or program. How large should the sample size be? The OHT determines how many patients to survey, but remember, HSPN can only send results when there are at least 10 patients. How are paper survey responses entered? If your OHT wants or needs to administer a paper version of the survey, your OHT is responsible for taking the information from the paper survey and inputting it into the web-based version via the general link from the survey package. How will OHTs know whom to follow up with? Privacy and research ethics requirements prevent HSPN from sharing names of survey respondents with OHTs. Therefore, we advise on sending out reminders every 2 weeks in order to improve response rate. What will the data cut look like? Here is an example of what the Excel file may look like. Answers will be provided in full along with the questions. Questions that are select all that apply will have answers as checked or unchecked. What information will be removed from the data cut? HSPN will remove any personal identifiers such as email addresses and the survey timestamps from the dataset. HSPN may also remove or combine certain demographics into larger groups to prevent identification if the frequency of responses is less than 6. How should results be analyzed or displayed? OHTs may want to focus on certain domains, for example, accessing care, transitions, being heard, or questions on the survey and calculate the average score, or report the percentage of respondents who selected the top 2, meaning most favorable, options by domain or question. Moreover, if sample size allows, OHTs may want to stratify results by demographic type. For ideas on how to display and interpret results, you can refer to HSPN's past survey reports linked in the description below. If you have any more questions, please email us at oht.evaluation@utoronto.ca.